Welcome to the Deep Dive. Today, we're looking closely at a really vital report. It's called On the Front Line of Climate Change and Health, a health worker eyewitness report.
Yes, it's from the Geneva Learning Foundation.
Exactly. And this isn't your typical academic study. It's based on what over 1,200 health workers are actually seeing and experiencing.
That's right, across 68 countries, mostly in Africa, Asia, and Latin America.
So our aim today is, well, first, to unpack these firsthand accounts. Understand what makes this report so different, so unique.
And crucially, how these insights can help you listening.
Yes, whether you're a health worker yourself, maybe seeing these things daily, or perhaps a policymaker trying to figure out responses.
Or even just someone interested in understanding what's happening and how to help.
So the big picture on climate change and health, the science has established that. But this report, it does something else, doesn't it?
It really does. It brings the day-to-day reality to life, what health workers in, low and middle-income countries are actually dealing with.
What they see, hear, feel.
Precisely. It puts a human face on the statistics, makes it undeniable. It helps us make sense of what's being learned straight from the source.
Okay, let's unpack that uniqueness then.
Yeah.
What is so different about how they gathered these insights?
Yeah.
It's not a standard survey, is it?
No, not at all. What's really groundbreaking, I think, is that it's described as a global first.
A global first. How so?
In really prioritizing the voices, the experiential knowledge of frontline health workers.
Experiential knowledge?
Yeah.
You mean what they know simply because they're there doing the job?
Exactly. What they know from their daily work, serving their communities, it's not theoretical, it's lived reality.
Which is often overlooked in traditional research.
Often, yes. Sometimes undervalued. There's a term for it. Epistemic injustice, where local practical knowledge isn't given the same weight. This report deliberately flips that. It recognizes health workers not just as people carrying out instructions, but as knowledge creators in their own right.
That's a significant shift in perspective.
It is, and this whole approach feeds directly into their peer learning course. Learning together to lead change on the front line of climate change and health.
So the report findings actually shape the course.
Directly. The course uses these very experiences. It moves past just lectures. It's about structured reflection, getting feedback from peers.
Peers who actually understand your situation.
Exactly. People facing similar challenges. The whole point is to help you, the health worker, develop real, practical plans for your specific situation. Learning together, essentially. Turning that lived experience into shared wisdom and action.
Right. That makes sense. So with that important background, let's get to the core of it, the eyewitness accounts. What are health workers actually seeing?
This is where it gets very real. The observations paint a pretty stark picture. Across everyone who responded, 3 health impacts really stood out.
Okay, what were they?
Firstly, malnutrition or undernutrition. Nearly 60% mentioned this. That's huge.
Wow, almost 6 out of 10.
Yes. Secondly, increased waterborne diseases, cholera, typhoid, things like that. Again, almost 60%.
Just as common.
And thirdly, changes in vector-borne diseases. Think malaria, dengue, how often they occur, or where they appear. Over half, about 51%, reported this.
So malnutrition, waterborne illness, and vector-borne diseases are the top 3 immediate concerns they're seeing.
That's what the overall numbers show, yes. And what's really striking is how interconnected these all are, and how they often hit communities already facing other difficulties.
Let's dive into the themes then. Can you give us some examples? Bring it to life a bit.
Absolutely. Let's start with extreme weather events. Floods, droughts, heat waves. We heard about the direct health consequences.
Loss of life, injuries.
Tragically, yes. By Lillian Mabando from Cameroon described a flood where a student died. Iruma Chinadu Ofortube in Nigeria spoke of a whole family swept away. Just devastating.
Oh, terrible.
And beyond the immediate deaths and injuries, these events cause huge disruption. People lose their homes, health facilities get damaged or destroyed.
Like clinics.
Right. Or equipment.
Exactly. Mugabekazi Justine in Uganda saw floods damage facilities. Dr. Avua Joseph Oteri in Nigeria reported the cold chain for vaccines being destroyed. That's critical.
Absolutely vital for immunization.
And then there's access. Roads become impassable. People can't get to clinics or supplies can't get through.
We heard that from Ghana, right?
Yeah,
And
that's Mohammed.
Right.
Ghana, Maloba, and Kuluani in DRC both highlighted how blocked roads cut people off from care.
So, thinking about our listeners, what's the key takeaway here? If you're working in health, What should this make you consider?
Well, it shows these climate events aren't just bad weather, they're direct assaults on the health system itself.
On the infrastructure, on access.
Right. So the question for you becomes, how resilient is your local health service, your clinic, your supply lines? Are there plans for when roads flood or power goes out or equipment is damaged?
It really underscores the need to build climate resilience into health planning, doesn't it?
Urgently.
Yeah.
These stories make that case very powerfully. Okay. Beyond those immediate destructive events, what else came through strongly?
Food, or the lack of it. That leads to the next major theme, food security and malnutrition.
Which was the #1 reported impact overall.
It was. Health workers described how unpredictable rain and long droughts are hitting farming hard.
Leading to crop failures.
Yes, and rising food prices. Margaret Afri in Ghana said farmers just can't study the weather as before. Dr. Ganda Tengremabambo in the Central African Republic linked drying rivers and wells directly to higher food costs and, consequently, more malnutrition, especially in children.
A direct chain of events.
A very direct chain. And there's a really concerning knock-on effect that came out.
What's that?
Patients stopping essential medication because they don't have enough food to take it with.
Really? Like what kind of medication?
Adelaide Mumbo Dlamini from Eswatini specifically mentioned patients stopping their ARVs for HIV because they felt sick taking them on an empty stomach.
That's incredibly worrying. Food scarcity undermining vital treatment.
It reveals a hidden vulnerability, doesn't it? It's not just about hunger itself. It actively sabotages healthcare.
So the insight for listeners here is, look beyond just malnutrition.
Yes. Ask, in your community, could climate-driven food problems be affecting treatment adherence? Is lack of food stopping people following medical advice or even seeking help in the first place?
It shows that tackling food security isn't just about nutrition. It's fundamental to overall health outcomes in these contexts.
Absolutely. And where food systems struggle, disease often follows. Which brings us to infectious diseases.
The second and third most reported impacts overall.
Correct. Malaria was a big one. Health workers like Yapalus Bomba in Guinea and Aro Jerry Achigani in Togo reported surges in malaria.
Why? More mosquitoes.
Essentially, yes. Environmental changes creating more breeding sites. Aro Jerry spoke of an exponential increase.
And waterborne diseases.
Also increasing. Contaminated water from floods, poor sanitation. Dudun Tanisgar in Chad talked about open defecation near rising lake waters spreading disease.
And there was a personal story from Kenya?
Yes, Cecilia Naburwa. Her grandchild got sick from eating vegetables grown near a sewage area. It shows how close the risks can be.
So more malaria, more cholera, more typhoid. Are new things emerging too?
The report mentions that as well. Old diseases reemerging, sometimes even infections they haven't seen before. The whole disease landscape seems to be shifting.
So on the ground, this means be alert.
Be alert, definitely. For your practice, are you seeing diseases pop up at unusual times in new places? Are there new symptoms you're not used to? It demands constant vigilance and adaptability.
Okay, so we have extreme weather, food insecurity, infectious diseases. What about other types of illness?
Good question. The next theme covers non-communicable diseases, NCDs, and respiratory illnesses.
Things like asthma, heart disease.
Exactly. Health workers are seeing links between climate factors and these conditions. Air pollution is a key one.
From dust or other sources.
Both. Sully and Jita in Cameroon linked chronic coughs to lots of dust during longer dry seasons. Dr. Kumbagopi in India connected rising vehicle use and air pollution to more respiratory problems.
And heat itself.
Higher temperatures can make existing conditions like heart disease or diabetes much worse. Harder to manage, especially if people can't keep cool.
So climate change isn't just causing new problems, it's making existing chronic ones harder to handle.
Precisely. It's an added stressor. So for your work, are you noticing more breathing difficulties? Are patients with NCDs finding it tougher to manage their conditions? It forces us to see environmental factors as really crucial parts of managing long-term health.
The physical impacts are clear. But what about the mental toll? Was that mentioned?
Very much so. That's the next theme. Mental health impacts. This came through strongly.
In what way?
Health workers talked about seeing real despair, hopelessness, depression, often linked directly to climate impact.
Like losing your farm or your home.
Exactly. An anonymous worker in Nigeria spoke of despair and hopelessness as hunger bites harder due to crop failure. Modaranki Kane in Liberia described the psychological trauma of people losing homes to floods.
A huge emotional burden.
Huge, and sometimes leading to other issues. Joseph Mbari Ngugi in Kenya observed links between job losses due to climate shifts and increased substance abuse, like alcoholism, driven by depression.
It really is a silent crisis alongside the physical one.
Hmm.
What's the key message for health workers here?
That climate change attacks well-being on all fronts. It's not just physical. So for your community, look beyond the obvious symptoms. Are you sensing more stress, anxiety, deeper mental health struggles?
And recognizing that these might be direct climate consequences.
That's the crucial first step. Seeing the connection allows for better, more integrated support.
Okay, one final theme, I believe, about specific groups.
Yes, the report highlighted gender-specific impacts, showing how these changes often affect women and girls differently and often more severely.
How so?
Water scarcity came up repeatedly, particularly how it affects menstrual hygiene.
Lack of water making it difficult or impossible to manage periods safely and with dignity.
Exactly, leading to infections. Linda Raji in Nigeria noted this increase in infections, and she shared something really quite harrowing.
What was that?
She observed that some teenage girls felt the situation was so difficult they actually preferred to get pregnant just to avoid 9 months of menstruation worries.
Goodness, that shows an incredible level of
It
desperation.
really does. And livelihood loss hits women hard too. Adi Joycelyn from Ghana reported that economic hardship was sometimes forcing women into transactional sex, increasing risks of STIs.
These are consequences we might not immediately think of, but they are direct results.
Direct and deeply concerning. The core lesson here is that climate change exploits existing inequalities.
Making vulnerable groups even more vulnerable.
Yes. So for your community, the question is, how are women and girls uniquely affected by these challenges? What specific support do they need? It really demands a gender lens on all climate and health work.
Hearing all these themes, these details, it's sobering. But you said earlier, these experiences aren't just problems, they hold solutions too. How does that work?
Well, these personal stories, they really bring to life how everything is connected, don't they? The environment, animals, people, health.
You see the ripple effects, clearly.
Clearly, a dry river isn't just a dry river. It affects crops, food prices, health, migration, mental well-being, the whole system. And these observations from the front line, they're a vital form of evidence.
Like an early warning system.
Exactly. They often pick up on emerging threats much faster than traditional research, which can be slower, more top-down. This is ground truth.
And this is where the Geneva Learning Foundation's model comes in again. The teach to reach idea.
Precisely. Remember the structured reflection and peer feedback. That model helps turn these individual insights, this grand truth, into shared learning and, importantly, action.
Connecting health workers so they can learn from each other.
Yes. Using digital platforms to connect people globally. They share what they're seeing, what they're trying, what's working. It allows for rapid sharing of practical solutions.
And does it work? Is it effective?
The results are pretty impressive. TGLF's approach has been shown to speed up local implementation of new ideas by 7 times compared to traditional methods.
7 times faster.
Yes. And maybe even more significantly, 82% of the participants find they can keep these initiatives going without needing ongoing external support. They build local capacity.
That sounds truly sustainable.
It aligns perfectly with what the WHO calls for community-led initiatives that fit the local culture and are truly effective. It proves that valuing and using local frontline knowledge is absolutely key to building health systems that can actually withstand climate change.
This whole conversation really highlights the incredible power in those eyewitness accounts. They show the human cost, yes, but they also point the way forward. Your observations, if you're listening, aren't just anecdotes. They're vital knowledge.
And that leads to a final thought, maybe a provocative one for you, our listener.
Go on.
This climate crisis, it doesn't just challenge us to know more, it challenges how we think about knowing itself. Whose knowledge counts?
You mean valuing that frontline wisdom alongside the scientific data?
Exactly. The future of health systems that can cope with climate change depends on blending that practical, lived wisdom from the front lines with global expertise. So think about your own experiences, your observations. They're a crucial piece of this global puzzle.
And platforms like the one from the Geneva Learning Foundation offer a way to connect that piece.
They empower you to share what you know, learn from others, and ultimately lead change right though in your community and contribute to the bigger picture. Your knowledge matters.